Good evening to all. The 39th medical term that we'll be discussing today is known as nasogastric tube. As we all know, the term naso means the nasal cavity and the gastro or gastric is the stomach. So it's a thin, flexible plastic tube inserted through the nostril, that is the openings of the nose, goes back to the throat, into the esophagus, and into the stomach. It is basically it's a diagnostic tool as well as even for as a temporary treatment, as a temporary solution, I would say. So there are three purposes where we use this tube. One is internal, that is for the nutrition, and the other one is gastric decompression as well as for the diagnostic purpose. So when you say internal nutrition, that means deliver the food or the fluids to the stomach, especially when they cannot take it through the oral or through the mouth. Gastric decomposition is where to relieve the pressure or the nausea using a suction to remove all the gas. Diagnostic purpose would be to obtain any gastric contents for analysis, especially during upper gastrointestinal bleeding. So there are different types, of which two of them are most important. One is the Levin Debrov tube, which is a tube with a small bow and a single lumen. It's very soft, and this is the one that we use to feed and medicate. But the second one is a Salom Sum, that is with a large bow and a double lumen. This, of course, is very rigid, and this is mainly for the diagnostic purpose, that is for the gastric suction, diagnostic as well as for the gastric decompression. So, how is this tube as you insert, and how do you verify whether the tube has, you know, entered into the right place? So first you ask a patient to position them at a sitting position. A tube is coated with a water gel. Then patients are asked to take a sip of water. Then you correctly place and verify that using an abdominal X-ray. Tube is secured to the nose with a tape to prevent any accidental removal or shifting or migration. With all the purposes, there are risks, like for example there can be discomfort, irritation, and even aspiration. Pneumonia can be caused because we are using a tool that is used in the hospital settings or clinical setting. Or even nasal pressure can cause ulcers, and even electrolyte balance because of this pressure and suction and all that. So but still it is used for a temporary solution under